All right. Hello, everybody. Welcome to a talk on applied functional science. And you're joining me with a beautiful sunset. I thought I'd liven it up. This is on main campus. So let's get into it, shall we? Applied functional science. So before we start, let's talk about where we've been. So what do we know so far in the first 2 weeks of class? Well, we know obviously that the human brain is wired for efficiency and it operates in movement synergies. Well, that is clear to us, right? And we've repeated it over and over again. Gary Gray's going to call these, with applied functional science, he's going to call these kinetic chain reactions. I like that because we all subscribe to the thought that the body is a kinetic chain and each joint is a link. And so what happens as we move one joint up and down the kinetic chain? That's really what we're going to talk about. The key here being to accomplish activities of daily living, or ADLs, that are very specific to your individual patients and clients. That's a key. Okay, so the brain's wired for efficiency and it likes to work in movement synergies. However, as we know, the body's prone to kinetic dysfunction, and these are predictable patterns that can be corrected. So the NASM model says we can correct them, and it allows us to address the common kinetic dysfunctions. We said that Yanda identified 3, but he really said they work in complex ways throughout the body. So, and even some of us have been talking in the past couple weeks, even new dysfunctions or syndromes are being discovered, and as people apply the foundational science more and more. So the FMS then, last week we learned, allows us to watch our clients move, not just assess them posturally, but watch them move and see what happens. And as they move, we identify faulty movement patterns, which are true in all of us. None of us is perfect. Maybe when we came out of the womb, we were. Many of us weren't, though. And now, after sustained postures, after sustained and repeated movements, we develop movement dysfunctional patterns. So identify those. FMS allows us to improve them, optimize movement quality through repetitive, correct movement, and educating new motor programs with the goal of optimally training. And as Gray Cook said, first we teach our clients to move well, then move often, and I would add, and then we load their movement. Okay, with that background, let's learn applied functional science. And the reason we're teaching you applied functional science, really there are a number of reasons, but you might be asking, why a third system? How is this different? What I'm going to tell you is that it's a very simple system involving a 3D matrix of movement in 3 planes, triplanar movement, that then allows us to assess and treat and then train clients. And so really, it's a very basic system that can be tweaked thousands of different ways. So there's endless creativity. So let's get started. So AFS, as you might know, is an applied biomechanics approach to looking at human function. This is why we chose AFS. We are big believers in a biomechanics approach to everything we do in rehab, in training, etc. So, and again, like I said earlier, we'll use it to assess patients and clients, but then also train. So the same system can be used as an assessment system and then also as a training system in 3 planes of motion. So here's the rationale, you guys. The human body moves obviously in 3 dimensions, but we rarely train it ideally in 3 dimensions. So we know that muscles react, joints move, and proprioceptors then respond in 3 dimensions. So as movement professionals, it only makes sense that we would train the body in the same way and make our progressions functional. Now, when I say functional, you probably have various different definitions that you've learned. Maybe you've taken continuing education classes or been involved in a gym or a therapy clinic, where they've thrown out the word function. So many definitions, and we can't go down the rabbit hole, but this is pretty vociferously argued in the community, in various communities. Let me throw one definition at you that I like for function. Function really is patterns or synergies, I like that word again, of motion that involve multiple joints acting in multiple planes to accomplish these fundamental movement patterns that we need for our ADLs, activities of daily living. So chew on that for a minute. The reason I like that is because it agrees with our philosophy that muscles are more than agonists and antagonists. They're more than single plane concentric actors, right? They're synergists. They both load and unload. These are new terms to us, load and unload. Not new terms, but the way that Gary Gray uses them in applied functional science are a little bit new. For concentric action, he uses the term unload. And for eccentric muscle action, like when a muscle is accepting load or accepting momentum and then storing in the series elastic component of muscle in order to explode, we call that loading muscle. So you load in order to explode, okay, or unload. Those of you who have done plyometric training might have used the word explode and various terms, but I want to throw those at you, load and unload, and we'll get into that more. So at its core, applied functional science is based on foundational biomechanical truths. Well, that's easy to say, but what are those truths? Well, movement, obviously, we just said is triplanar, but it also involves reactions with gravity. Probably most of you have considered that, but some of you may have not. You know, gravity changes everything, right? If we weren't operating against gravity and with gravity, our muscles would have a much easier job in life. And then we have ground reaction forces coming from the ground up, but then also top-down forces, and then our own body weight, right, which creates top-down forces down through the kinetic chain. And then momentum, right? A body in motion tends to stay in motion. And so here's a key, I think, of applied functional science, and we'll get into this as we go joint by joint, but how we absorb momentum and then transform it into movement really affects whether or not we're efficient in movement, but it also could cause injury. If we can't control motion well, that's when injury results. Think about this. How do non-contact ACL injuries happen most often? Well, they happen in the transverse and the frontal plane, right? Frontal plane with knee valgus, transverse with the femur's inability to control or decelerate rotation internally. Well, those are both momentum actions that are controlled by muscles. And if a patient or athlete can't control those motions, then they put excessive strain on their ACL. So I think that's a truth that we need to learn. Okay, here we go, you guys, the 3D matrix. And I'm gonna show this to you in a video in a minute. The 3D matrix is the overall strategy used by AFS to facilitate motion. What are the 3 dimensions? Well, this shouldn't shock anybody. The 3 dimensions are sagittal plane, frontal plane, and transverse planes of motion. So we use the matrix to create an environment of chain reactions within joints. Think about this. If this, like this gentleman, if we have him lunge with his right foot forward, and let's just say he's not a hyperpronator, but let's just say his subtalar joint goes through a lot of hyperpronation and his medial foot just crashes right into pronation. You know that creates a series of kinetic chain reactions up the chain. Sorry, I'm losing my cursor here. Up the chain, through the ankle, to the tibia, to the knee, into the hip, and into the lumbar spine, right? And so Gary Gray would say that just by doing this simple lunge forward, you're creating this rich proprioceptive environment up the kinetic chain involving multiple chain reactions that then his body has to control. And so that's a really good thing. In this case, this man on the top is using his foot as a driver. And so AFS talks about drivers. We can use feet, hands, gravity, etc. So as he lunges forward with his foot, he's using his foot as a driver to create a chain reaction. This slide I typically show in class if we're face-to-face, and we go through all these matrices here. This is actually Gary's son, Doug, doing each matrix. But what I want to say to you here is the matrix uses 8 fundamental movement patterns. And so you see 3 of them here. So lunging, squatting, and balance reaching. There's also hopping, jumping, reaching, etc. Okay, so each of these fundamental movement patterns is going to have a matrix that we can design. And so I created a video for us. This video, I've had some success sometimes recording these videos, but if I can't, one second, if you can't see this video effectively, this video will be posted immediately below the video you're currently watching, okay? All right, so I know that was probably a little blurry. Hopefully that showed through, but if it didn't, you have the video just below this video, and it's the normal YouTube link. What I also wanted to do is, so that was just the basic. Let me remove my cursor here. Excuse me, one second. Okay, so this next video I'll let you watch on your own just because it won't blend through on a Zoom recording very well, but it's a bunch of tweaks, and you'll see at the end of this that I get tired, and you can even work up a sweat, which brings up a good point actually. You can use this for assessment, but you could also use this for movement prep or treatment as well. So watch this video, which also will be linked in Canvas below the video that you're watching now. Okay, so after you watched, hopefully you watched those two videos in sequence, and now you're joining us again. As you watched those, you saw lots of things. Yes, you saw that this is very simple, and you've probably seen this in the gyms or in the clinics that you've worked at because it's really used extensively. And Gary Gray is one of the first, if not the first, therapists to use it, and so that's why I want to teach his system. But you saw me moving in the sagittal, frontal, and transverse planes. You saw matrices that involved multiple joints, right? So Gary Gray would call these movements that involve individual joints, he would call those local movements. And so any joint, in other words, you could design a matrix that would get your patient more dorsiflexion. That would be the goal. So that's a very strategic local foot and ankle matrix, right? But then there's global. So if you wanted to get more core stability, you may do a forward lunge with an double overhand reach with their hands. Sorry, I should say double overhead reach with their hands. And that's going to be a global movement pattern, like reaching overhead to, catch a pass. And you saw we went from simple to complex movements. And what you didn't see is that we could go stable to unstable. I could have thrown a BOSU in the middle of the matrix. Yeah. Or an Eric's pad, et cetera, okay? And then, so now you're starting to see that creativity can drive limitless possibilities. So we could insert our hands, our feet, our eyes, we'll get into that later, gravity, et cetera, all to introduce different tweaks into these matrices, okay? Gary likes to say you use drivers in all three planes of motion to facilitate motion or to turn on proprioceptors so that the body responds and reacts, that efferent muscular response. Just a side note, there's other ways to progress. I wanted to point out to you the ways in which these models sort of agree and they take stuff from each other. The NASM example, this progression that they use is pretty much based off of Gary Gray's matrix progressions. But in addition to that, we could go like you saw me doing with the squat bilateral stance, alternating feet stance, alternating hand stance, like you saw in the push-up matrix, double leg to single leg, stable base to unstable base. And then again, to say it more succinctly, anytime we drive overhead motions, we're going to produce more stress through the kinetic chain, through those anatomy chains, right, that we talked about, or anatomy trains you've heard, and stress the entire fascia. So the approach you can see is triplanar, is based on foundational science, but it's also individualized. Well, what does that mean? Well, we want to not just have each client or patient just go through the whole matrix, like in other words, the whole clock, take your lunge in all directions. We actually want to watch them and see. What you noticed is that when I did the balance reach matrix, and I lunged back to 6 o'clock and over to 8 and 9 o'clock, you might have seen me shake a little bit. Yeah, I was showing you a weakness there, right? So then your design for me could have been, hey, Jeff, go on your home exercise program, go and do those 6 to 9 o'clock lunge reach, those posterior reaches, that matrix. And that's the prescription you give me. So it's individualized, okay? And also, another thing Gary likes to say is the test can become the exercise. So if you see a weakness in a particular test, much like the FMS, right? If somebody can't do the hurdle step, well, then you give them exercises to increase their movement efficiency in that particular test, okay? So very simply, the test also becomes the exercise, okay? And the test is designed to identify what a patient can do. And then we sniff out their dysfunctions like we did with me on the 6 to 9 o'clock posterior reach. And then, this also should be familiar to you. We use the matrix to first address and create mobility. Mobility, just like FMS, mobility is our first priority. Once we have that, then we train strength and stability, okay, for the functional needs of any population. I'm throwing a bunch of visuals at you just so that you know that applied functional science uses directional references. Most of you know this medical terminology: anterior lateral, medial, anterolateral, anteromedial. And so just study that out a little bit. And so that when we progress these matrices through the foot, ankle, knee, hip, etc., we'll become familiar with it. And some of you might have seen this here because the Institute of Motion has actually adapted these 27 foot postures to do some of their programming. Again, another place that they're all kind of sharing content. and just do a simple lit search, you guys, not lit search, internet search. I just did this prior to making the video, but you know, athletic trainers in the house, you'll know that we use tape for everything. So if you guys own a clinic or work at a clinic and you want to implement the Matrix system, all you need is tape. Put tape down on the floor, have your patients start moving in multi-plane directions, okay? You can see here, ACE has used the Matrix system in their CPT training. Here's a running progression. You could see a runner using this for movement preparation, getting the arm drivers in there. And then this is ESPN.com down here using the Matrix system. All I'm trying to say is you've probably seen this everywhere. So some of this is very redundant for you. However, I would challenge you to do all of these exercises. You saw the note I made under the video. Do all of these exercises yourself. See for yourself how much movement you can gain and assess using your arms and legs and knees, etc., as drivers. I'm telling you, it is pretty dramatic how much range of motion you can get and stability using this. Okay, I'm done. Other than to say that next video we'll talk about strategies applied functional science, those global fundamental movement skills, and then also the local isolated movements. Hopefully you're getting a little bit excited saying, if I need a little bit of hip mobility in my patient, and who doesn't need hip mobility, I can use a joint specific local strategy. Whereas if I just need people to stabilize their hips in the frontal plane as they move and walk, right, or lunge, I can choose a global movement. And then I can tweak a bunch of different, what Gary Gray calls them, observational essentials. 10 different elements that we can tweak, like height and speed and load and direction, all of those. That's just 4 of them. They have 10. Okay, so that's the next video. Thanks for listening, everybody. And I'll be coming with the next video very soon.